Hello there, welcome to the final episodes of Putting Dr. G on the Spot in the month of November, where we have focused the whole month on the treatment and also diagnosis of testicular cancer. Starting from microlithiasis, we talked about radical orchidectomy, putting in prostheses, and today we're going to use an example of a very famous personality who suffered from testicular cancer and overcome this cancer and adversity and overturn it to become an inspiration. This is none other than Lance Armstrong. Lance Armstrong, actually in 1996 at the age of 25, was discovered to have testicular cancer. Unfortunately, this was a bit too late for him because when he actually first discovered he has got testicular cancer, despite actually having it for a few months, he coughed out blood and also had headache, and what turned out was that he had metastases to the brain and also to his lungs. For most people, we would think that this has a very, very poor prognosis of 40% survival. So he was rushed to the hospital and underwent a radical orchidectomy. The removal of testicle is crucial because that will determine whether this is seminoma or non-seminomatous germ cell tumor. And from that point onwards, he also underwent another operation, which is removal of the lymph nodes in his para-aortic glands, and that's called para-aortic lymph node dissection. With that, the platinum-based chemotherapy is the absolute turning point because that will actually eliminate the cancer with several treatment doses, and that itself is what happened to Lance Armstrong. From 1999 onwards, he overcome the surgery on his personal life. He had multiple partners and actually had multiple children. So that didn't impair his sex life or his chemotherapy-induced infertility. In addition to that, he also turned adversity into inspiration. What he said is that pain is temporary, but quitting is forever. Indeed, that's true because what he continued to do was be an inspiration to many people. He started raising money for more than 500 million for his Live Strong campaign and also the Yellow Band campaign. But more importantly, he raised a lot of awareness to know that testicular cancer happens in younger men, and therefore regular self-inspection will help you to overcome all these problems of testicular cancer and also poor prognosis. Next week is going to be the final month of the year, and to make December a little bit more light-hearted, I'm going to tell you a few operations in urology that is quite humorous. First operation that I'm going to talk about actually is penile elongation. Stay tuned for next week's Putting Dr. G on the Spot.